What is the difference between type 1 and type 2 diabetes?
Okay. Type 1 is an autoimmune disease, and their beta cells get killed. And so they no longer make any insulin or very little. And it does have a hereditary factor involved, whereas type 2, it also has a hereditary factor involved, but it has another factor. If you have been real inactive or you have a tendency to be overweight, some of those risk factors can cause you to have insulin resistance where your own insulin won't work like it should. And so therefore you get a high blood sugar, which is diabetes.
For type 2 diabetes, what are the risk factors?
Some of the risk factors are hereditary. It runs in your family. Another one would be that you have obesity or you're overweight or you're inactive. Another one is you have a big stress in your life that happened along with the other risk factors. And race plays a factor, what race you are.
What are the best ways to prevent diabetes?
Some of the best ways to prevent diabetes would be to keep an active lifestyle, and that would mean about 5 days a week having 30 minutes of activity every day, like walking or biking or swimming. And then the other one is to learn healthy eating patterns, not eating out a lot where you have large amounts of fat and carbohydrate.
Does a person's blood pressure and cholesterol put them at a high risk for diabetes?
Yes, it does. I probably, in the last 20 years, all my classes, I have at least half or 3/4 of them have already, they have hypertension, they have high cholesterol, and they also have the belly fat. When your fat collects kind of on your belly rather than on your hips, those are risk factors for diabetes.
What do you think is the biggest myth about diabetes prevention?
Let's see, the biggest myth about diabetes prevention would be in type 2 diabetes, it comes on very slowly. So you get what we call pre-diabetes, years ahead. And the myth is that when your doctor says to you, you have pre-diabetes, that you think, well, I can't do anything, I'm going to get it anyway. But many people can either prevent or keep diabetes away for several years if they would just start eating healthier, exercising, and maybe getting their weight down.
Nancy Klug, Certified Diabetes Educator here at Tucson Medical Center. Thank you for your insight. We appreciate it.
You're very welcome.